Hi everyone. What I want to share with you today is going to blow your mind. As many countries appear to struggle with a second wave of infections, we've seen new lockdowns, travel bans, no-fly lists, quarantine measures, and other trade and business restrictions reimposed with very little justification. These are very costly policy decisions on the back of the huge unnecessary economic damage already done. Millions of people have already lost their jobs, their businesses, their livelihoods, and millions more are hanging on by a thread, praying for an end to the pandemic and lifting of restrictions, particularly in tourism and the hospitality industries, which were the hardest hit by far. These critical decisions are mainly based on one metric, the number of new daily cases over the last 7 days. And this number has skyrocketed in many countries that previously had the virus under control. Why is that? Well, one reason is that countries are testing a whole lot more. But why are deaths and hospital admissions not going up along with the case numbers? Well, this recent paper in the Lancet may provide a clue. I encourage you to read it and I'll link to it in a comment. We are not counting false positive test results. Here's the problem. The PCR test we use to detect the presence of SARS-CoV-2, the coronavirus that causes COVID, cannot detect disease or an active infection. It detects minute amounts of virus RNA. It can also return a positive result due to non-infectious virus shedding from a previous infection, or from antibodies, or from an infection with another coronavirus. It is not very precise, and it does not confirm if someone is infected. Yet they are using this test to base critical decisions on. Health workers don't back up the test with a viral lab culture to confirm that the person has the virus. The test works best if someone has symptoms. But in the absence of clinical symptoms, the test is not as reliable as we'd like it to be. Now, the Lancet paper mentions that the estimated false positive rate of the COVID-19 test is between 0.8% and 4%. And let's say the false positive rate is 1%, which is a nice round number near the low end of that range. A 1% false positive rate sounds pretty low, right? It sounds like a pretty accurate test with a small chance of error. But what does that percentage really mean? Here's what it does not mean, but what most government officials seem to think it means. It does not mean that 1% of positive test results are false. So if we test a bunch of people and we get 200 positive results, it does not mean that 2 of those 200 got an incorrect result. That would not be a big deal. Here's what it does mean and why it is a big deal. A false positive rate of 1% means that 1% of true negatives will accidentally test positive, even though they don't have the virus. Now this changes things, because this means if you test 1 million people who don't have the virus, you will still get around 10,000 false positive test results. And that's a huge number. We are testing millions of people. That could be enough to trigger lockdown or travel bans. Do government ministers understand this? Well, here's the UK's Health Secretary, Matt Hancock, showing that he apparently does not understand this at all. He thinks it's a percentage of the positive cases. Take a listen.
Because we know that coronavirus cases are going up. But again, lots of people, including Carl Hennigan, Professor of Evidence-Based Medicine at Oxford University, who has helped to influence some changes in government policy recently, has pointed out these aren't cases of coronavirus. These are people who've tested positive for the test. What is the false positive rate on the testing that we're doing in the community?
Under 1%.
It's under 1%.
Yes.
Even around under 1%. Do you know the exact rate?
Under 1% means that for all the positive cases, the likelihood of one being a false positive is very small.
So the Health Secretary appears to think below 1% means a tiny number of positive results are incorrect. But that's not what it means. Firstly, we don't know that it's under 1%. It's somewhere between 0.8% and 4%, according to the Lancet. So it could be more than 1%. And secondly, let me explain what the Health Secretary appears not to understand. If you test 1 million people and the false positive rate is between 0.8% and 4%, you can expect between 8,000 and 40,000 false positives, even if no one has the virus. Now let's look at this so-called second wave. In the UK, during August and September, they tested about 8 million people. Most of those had no symptoms at all. If the false positive rate is 1%, that's at the low end of the range, how many tests will show a positive result, even if none of those 8 million have the virus? Well, 1% of 8 million tests will give you about 80,000 false positives. That's a huge number. And it could be more if the percentage was higher than 1%. We don't know the exact number. We only know it is somewhere between 0.8% and 4%. So how many actual positive test results were reported in the UK in those 2 months? They found around 142,000 positive tests. That's roughly 1.8% of the total number of tests. Do you see the problem here? How many of those were false positives? We don't know. We can assume at least 80,000 of them, probably more. It could well be that the vast majority are false positives. We already know that most of those people don't have any symptoms. Hospitals are not being overwhelmed. The number of deaths have stayed low. And this is true for most of the countries that reported a second wave. Here's the UK chart of new daily cases on the left, showing the second wave, and daily deaths on the right. Look at the difference. A slight rise in deaths, but nothing like back in April. And the same thing in the Netherlands. The number of deaths have not spiked nearly as much as the spike in new reported cases, which is higher than it was back in April. The same pattern appears in many countries that show a second wave of infections. And when you look at the COVID hospital and ICU admissions for Europe in mid-September, during the second wave, they were 8 to 10 times lower than they were in April. So why are we ordering lockdowns? Why are we banning travel and closing borders? Why are pubs and restaurants being forced to close and suffer even more financial hardship? Why are all these countries deemed unsafe and put on a no-fly list? It's because all these test results are being reported as actual COVID-19 cases, even though hardly anyone is sick. There seems to be no understanding of the impact of false positive test results. Now, let me just quickly add something here about false negatives. A false negative is when someone who does have the virus tests negative. Back in May, the false negative rate was reported to be as high as 20%. Doesn't that balance out the false positives? It's a good question, but the answer is no. Not if the overall percentage of positives is very low as it is right now. Back in April, when up to 40% of tests conducted were positive and most people tested were showing symptoms, the false negative rate was a concern. And guess what they did? If somebody with clinical symptoms who had been in contact with an infected person tested negative, they realized it could be a false negative. They don't immediately believe that result, and they would test that person again a day later to confirm. But now, the rate of positive test is very low. And remember, the false negative rate only applies to those who are true positives, those who have the virus, while the false positive rate applies to those who are true negatives, who don't have the virus. So if you're testing 1 million people and only 2% have the virus, the impact of false negatives is minimal. It only applies to those 2%. But the impact of false positives is huge. It applies to the other 98%. So most of your positive results could well be from false positive tests. And get this, in many countries they've scaled up testing and now doing random community testing of people who are not sick. If the clinical picture doesn't fit and the person has no symptoms, but they get a positive test result, do they suspect that it's a false positive and test them again? No, they don't. They don't retest them. They report it as a positive case and tell the person to isolate. This is not good science. We've got a bunch of healthy people showing up as COVID cases, and we're making very expensive, disruptive decisions on the basis of these reported cases. This is criminal stupidity, to quote Paul Weston in his video. Now, please hear me carefully. I'm not saying there are no cases at all. There is a small rise in new infections, and some of those do have symptoms and are admitted to hospitals. Even deaths are showing a small rise, but it is nothing like we saw back in April. It's no reason to panic. This can be expected as we return to our lives and open the economy again. We need to learn to live with this virus. And once you adjust for false positive cases, the numbers certainly do not justify lockdowns and travel bans.